Nurses of Reddit, what's your worst work-related story? There are so many to choose from, but here are a couple, which are actually quite sad as well. A lady who lived by herself had fainted on her patio, and no one found her until 3 days later. She had been lying in her own feces, and when she came into the hospital, we found live maggots crawling inside her vagina. We had a very, very obese and diabetic lady, 250 kilograms, who was only in her 50s, admitted with infected necrotic wounds on her apron. Unfortunately, she had left it for so long that the only option left for her was surgery. However, surgeons deemed her unsuitable for surgery. She eventually passed away, but what was so eye-opening to me was that we had to order a specific body bag for her because she couldn't fit into a normal one. It took 2 wardsmen and 5 nurses to get her into a body bag. Had an 18-ish-year-old come in. She had been found in the fetal position covered in shit and naked in her bedroom by police. She'd basically been locked in there by her parents for years for most of her life. She kept asking for her mum because she didn't know how to do anything. Her mother was still trying to control her from prison. My mother-in-law is a nurse, and every year around Christmas there is a man who comes in with a candle stuck up his bum that progressively gets bigger. Last year she compared the candle to the size of a pickle jar. Had a nice older gentleman patient who was tachycardic, but all his labs were normal. He seemed like he took fairly good care of himself, was a little disheveled, but he dressed nicely and had nice shoes. We initially couldn't find anything wrong with him, but he had a peculiar odor to him that seasoned nurses would get suspicious of. I asked him if he had any infections on his body that he knew of, and he said no, but I wanted to do a thorough check, so we took off all his clothes. He was fine until I got down to his feet. He was wearing an old pair of socks, and as I peeled them down, the skin around his foot literally came off with the sock. I was essentially degloving his foot. It was so vile I couldn't even get down more than a couple inches. It was raw flesh under those socks. The wound odor was so strong I knew then that his feet were the source. He probably hadn't changed his socks in several months. He ended up being admitted and given lots of antibiotics and wound care. The memory of pulling down his socks will haunt me forever. An elderly meth-addicted prostitute was admitted for sepsis yet again. Cultures are all negative until someone sees that her colostomy is a bit too red and puffy to be considered normal. We cultured it, and she had syphilis as well as a bunch of MRSA. Turns out she was letting some of her Johns fuck her stoma. When we told her what we had figured out, she just shrugged and said that a hole is a hole. Posting one more that I just remembered. A 20-year-old patient in for a motorcycle accident sans helmet. The kid survived, but was never going to be not a vegetable living off of 15 different tubes ever again. He literally lost too much brain tissue. That kind of stuff is par for the course in a level 1 trauma center. What was hard was watching his parents stay in his room in shifts, documenting every little twitch and spasm and reporting it to us as a sign that he was waking up, only to have to be gently told, after assessing of course, that they're just spasms with no conscious thought. They would also happily keep telling us about the welcome home party they had planned for him, and making jokes that they're never letting him buy a bike again. One day they started visiting less and less, and eventually stopped coming at all. Finally, they made him a DNR. He was their only child. A couple years ago, I took care of a long-haul trucker who developed a wound on the underside of his ball sack. The vibration of the truck seat wore away at his scrotum, and he developed an infected ulcer. As you can imagine, this makes for a very fragile situation. One day we were helping him out of bed when his scrotum ruptured wide open, pus splattered everywhere, and his testicles flopped out. A bad day for all involved. Also worth a mention, I've seen multiple patients come in with maggots in their festering wounds. How does a maggot infestation in your body go unnoticed? And for fun, one time I had a patient fresh out of open heart surgery try to escape through the toilet. He was having DTs and withdrawals from a variety of street drugs. Found him knee-deep in the toilet trying to swim out because he loves the smack. 4 security guards couldn't hold him, even with chest tubes, mid-sternal incision, Foley, the whole works. Don't do drugs, kids, but if you do, please tell us which ones. Labor delivery nurse here. The stillbirths are the most horrific, gut-wrenching things I've ever experienced. A woman full term comes in, and her complaint is that she hasn't felt the baby move in some time. Okay, let's take you back to a room real quick and put on the monitors. I perform Leopold maneuvers, feel mom's belly to determine the position of the baby and where to place fetal monitors, and turn up the volume really loud and place the monitor. Nothing. Let's try the other side of the belly. Still nothing. Normally the heart rate is so easy to find on a full-term baby and doesn't take more than a few seconds of moving the monitors. At this point, the mom is shaking and getting nervous. We both know. I'm trying to keep myself calm and tell her in a soothing voice baby must have turned at some point and might be breech, making it harder to locate the heartbeat. I get the doctor and an ultrasound machine, and it's crystal clear on the screen. You can see the baby, the head, the spine, the dark spot where the heart is, and nothing. No cardiac activity, no movement. We break the news. The mom starts bawling. I start crying. The doctor starts crying. I will never forget those screams. Jesus Christ. I love my job, but those are the hardest days. My father worked in ER at the beginning of his nursing career, and he said one of the hardest things he had experienced was a young man who shot himself in the face but was still alive. All that was left was the back of his neck/bottom part of his skull. The man died a short time later, but could you imagine seeing something like that? God bless nurses. They truly deal with so much. Too many to choose from, so I'll just go with a recent one. I was doing wound care on a diabetic man who took zero care of himself. It was a foot ulcer with necrotic tissue and gangrene. As I was pulling the old dressing off, I felt a subtle crunch. I looked and saw that, yep, the dressing pulled one of the man's necrotic toes completely off with it. He just sighed and said, "Not again." Turns out that just a few months ago, his other foot was at that level of ulceration, and one of those toes came off when he went to put shoes on. How he failed to notice the smell and severity, although to be honest he was morbidly obese and couldn't even see his feet, is a mystery. Not a nurse, but a medical assistant. I was on my first day on the job at urgent care and was asked to assist with an abscess drainage. I said sure. I walk into the room and the patient is laying on the bed with her legs in stirrups. No big deal, just assumed the abscess was on her inner thigh, maybe. Wrong. She had 2 abscesses, one on each side of her labia, each about the size of dates. So the doctor cuts into the first one. Now, usually with abscesses, you cut it open and blood and pus drains out. This one, though, she cut it open, and a green fluid the consistency of molasses started to leak out. The smell was so terrible, but I could not react as the patient could see my face, and I did not want to embarrass her anymore as she already was having vaginal abscesses drained and all. When the draining slowed down, the doctor literally started pulling on it, basically roping it out of the wound. After packing the drained abscesses, I had to bandage her up. After the patient left, I was congratulated by my coworkers for keeping composure, especially for it having been the first procedure on my first day. I loved that job and miss it every day. I don't really miss the craziness, but it made my job interesting and fun. Not a nurse, but I work in the emergency department. Patient came in and said he hadn't pooped for a week. The doc prescribes some stool softeners and decides to send him home without ensuring that he had a bowel movement before he left. Patient comes back 6 hours later. He's having severe abdominal pains and is brought in one more time. Patient is put on a bed and scheduled for some type of scan. All of a sudden starts feeling nauseated. Patient then starts literally throwing up his feces. He was obstructed. The nurse and attending run into the room, nurse pushing on the stomach and attending holding his back trying to get the rest out. He aspirated and had a heart attack. The shittiest way to go. Edit. It wasn't a small amount of feces. The room was shit lake. A man was discharged from a mental health facility a few days prior. He went home and built a gun in his garage out of pipes. He proceeded to shoot himself in the chest. His wife called EMS. He was talking when he came into the ED. He asked for water because he was thirsty. This is usually the first sign someone isn't going to make it. The CT scan showed there was a bullet in the heart. He was rushed into my OR. The trauma surgeon split the ribs and was feeling around for where the bullet went. Meanwhile, the front desk is trying to get a hold of the cardiovascular surgeon on call. He's out of town and says to call one of his partners. The first partner is also out of town. The second and third are both an hour away at other hospitals. The trauma surgeon finds a hole in the left ventricle. I am able to get a hold of another surgeon who isn't on call but is 20 minutes away. He says the patient needs to get on bypass if there's any chance, but he'll probably end up dying anyway. Anesthesia is on a massive transfusion protocol, but his vitals are not improving. The surgeon opens the pericardium, and it sounds like a water balloon hitting the pavement. In an instant, a liter of crimson-colored blood pours out of the drapes and onto the floor. Anesthesia calls out, "There's no pulse." Another liter and a half pour from the drapes. We now know where all the blood went. The next 2 hours include filling out paperwork and calling the medical examiner. I have to speak to the widow and his mother about signing the forms for the ME. His death will have to be investigated by the county. However, this one isn't as emotionally tough as the 12-year-old who crashed a side-by-side on a coworker's property. He was declared brain dead the next morning. The staff lined the halls for an honor walk as his bed rolled by to the OR for organ procurement. As the father of 2 young boys myself, I broke down and cried as the mother said goodbye. She adjusted his blanket to keep him warm and kept telling him, "It'll be okay. I'll see you later. It'll be okay." And that concludes the worst work-related stories from nurses on Reddit. If you enjoyed this video, give this video a like, subscribe to our channel, and click the notification bell so you never miss an upload. And before we end this video, let's give a big shout out to our amazing nurses. We can't thank you enough for all the incredible work you do. You are all superheroes. Once again, this is Reddit Story Hour. Stay curious, stay kind, and see you in the next video.